This presentation will talk about the consequences of workplace fatigue and the impact on patient care, specifically on ethical decision-making and prejudice. This might be a familiar picture to some. Coffee in hand, feeling tired at work. Your keyboard looks like the perfect pillow. You just didn't get enough sleep last night, you tell yourself. But is that really all that's going on? Fatigue is caused by long hours of work, mental or physical activity, inadequate rest, and/or excessive stress. Symptoms of fatigue include tiredness, sleepiness, microsleeps, irritability, depression, giddiness, loss of appetite, digestion problems, increased susceptibility to illness, and impairment of mental or physical tasks. Some of these impairments include slowed reactions, failure to respond to stimuli in your environment, flawed logic and judgment, an inability to concentrate, increases in memory errors such as forgetfulness, decreased vigilance, reduced motivation, and an increased tendency for risk-taking. Chronic sleep deprivation occurs when sleep is cut short for weeks or months at a time. Each additional day without sleep adds to the sleep debt. Even a loss of 1 hour per night increases the tendency to fall asleep. And 1 week of sleep reduction is enough to produce fatigue. The only effective and long-term strategy to prevent and manage fatigue is sleep. So what does fatigue actually do to your brain? The prefrontal cortex is vulnerable to the effects of fatigue. This is where complex cognitive processes such as self-regulating behaviors and executive functioning take place. Brain imaging shows that the greatest fall in the cerebral metabolic rate is in the prefrontal cortex, indicating that glucose levels in this area are substantially limited in people who are low on sleep. Low glucose means that the brain doesn't have the energy to function properly. This is why we start to see diminished capacity. Lack of sleep diminishes the ability to make good decisions. So what does this mean for occupational therapists? Ethical decision-making is the process of evaluating and choosing among options in a way that is consistent with ethical principles. It involves perceiving and eliminating unethical options and selecting the best solution. The ability to suppress choices that are desirable but unethical is vital to making ethical decisions. People take costs and benefits into account when considering alternative actions. For instance, imagine that you are responsible for reporting the number of hours that you work each day. Over-reporting your hours would result in more monetary compensation, but it wouldn't be the ethical thing to do. Self-control is needed to make these decisions, but low levels of sleep hinder our ability to overcome impulses. Sleep is positively linked to self-control, as it is needed to replenish cognitive resources. Cognitive depletion is a diminished capacity to exert control over one's thoughts, behaviors, or cognition. This has implications not only for making ethical decisions, but also on how we treat our clients. Stereotypes act as cognitive shortcuts that allow individuals to make quick judgments. Cognitive control helps us avoid responding in stereotypical fashion, but fatigue diminishes this control and can increase racial bias and prejudice. A study by Ma et al. Looked at the effect of fatigue on decision to shoot in police officers. Their findings have implications for occupational therapists as well. They conducted experiments in which cognitive depletion and sleep were manipulated and found that a significant racial bias was seen in participants when they were fatigued. As occupational therapists, we are in a position of helping others. We work with a wide variety of clients, most of which are vulnerable populations. Stigmas and prejudice are already rampant in healthcare, but part of our job is to see beyond these to help our clients. If you are fatigued, you are not working at your optimal cognitive capacity, and ultimately is it our clients who will be impacted. So what can you do? As it was said before, sleep is the only way to manage and prevent fatigue. Adults generally require between 8 and 7 hours a night, although this does vary. Make sure that the sleep you are getting is restful. Limit caffeine and alcohol intake during the day and limit the exposure to light before you go to bed. Remember that occupational therapists are all about a work-life balance. Make sure you take care of yourself so that you can take care of your clients. For more information on how fatigue can impact you, visit the National Sleep Foundation at sleepfoundation.org.